Hello, everyone, and welcome to our CWC Youth Track event titled Dream Big with Optimal Sleep. Today, we'll be discussing benefits of sleeping and the importance of doing so with our very special guest. I first want to thank you all for joining us here today for our CWC event. So now I'd like to introduce Dr. Sanjay Agarwal, our speaker for today. He is a clinical assistant professor at Kansas City University. He is the CEO and president of Comprehensive Sleep Center, a California Specialty Physicians. He has over 20 years of clinical experience across the major US healthcare systems, and he's the founder of a successful pulmonary and sleep care venture. So, really excited to hear more about you, Dr. Sanjay. So, please go ahead and introduce yourself, and we're really excited to have you here today. So, thank you.
Hello, everybody, and very good evening to you guys, and thank you for joining on a weekday. And I would, you have already introduced me, said enough about me already, Kevin. So today's objectives, we're going to talk briefly about the basics and what is the importance of sleep, how is sleep construed, what's the building block of sleep medicine in general, and we're going to talk about everyday sleep disorders. Now, briefly about the lifestyle practice as to what healthy sleep habits are, and overcoming some of the challenges of sleep medicine and the best practices and personalization to each of our life, right? And we'll summarize towards the end. So, sleep is very important. Out of the three things they say are important to maintain a wellness or keeping us healthy is sleep, exercise, and diet. And we have the excellent nutritionist in the panel now. And we always talk about exercise and we always talk about sleep now, which is becoming more and more people are aware of it. So these three constitute, if you do this well, then it's construed that we will be about 80% healthy. All the diseases, whether it is hypertension or diabetes or any other illnesses, can be taken care of. So sleep disorders are the most common medical complaints. It's recommended as a fifth vital signs, apart from your pulse and blood pressure and temperature. We consider this fifth vital signs. And in all the family medicine practice since 2008, we have been requesting as sleep as one of those important features to be asked for. Apparently, 75% of adults have at least one symptom of a sleep problem. So sleep medicine is a newer branch of medicine in the last maybe 20 years. More so, awakening has been happening in the last 10 years or so. Everybody talks about sleep quality, sleep quantity, sleep apnea, insomnia, and yada yada yada. But I think so more people are becoming aware. But in general, if you take about 85, 90 different sleep disorders, I would say about 75% of them have some kind of sleep problems in the daytime. And it's increasing every year by year. Insomnia is the most common sleep problem. People don't realize as to what constitutes insomnia, but insomnia is not able to sleep through the night or not able to maintain sleep. It affects about 10 to 15% of all adults, but apparently about half of patients have given some kind of insomnia symptoms once in a year. And millions with other sleep problems, like as I mentioned, 85 different sleep problems. Sleep apnea is one of the commonest one people talk about, or other causes of excessive daytime sleepiness, or circadian rhythm problems like sleeping in wrong timings, restless leg syndromes or narcolepsy, idiopathic hypersomnias, parasomnias like sleep talking, sleepwalking, and other problems. So we have almost about half the world have some kind of sleep problems in general. National Sleep Foundation's 2008 Sleep in America poll found about 36% of adults also drive while drowsy. So DUI we talk about, but apparently more accidents happen on the highway because of sleep apnea or other sleep problems than just DUI or driving while drunk. So what is normal sleep? So normal sleep, as you can see on the cycle here, it is constitutes of each of these cycles, which is about 90 to 120 minutes. And as the cycles are aligned with each other, about 5 to 7 cycles constitute about 7, 8 hours of sleep. So it is said that we need to have these cycles together and we want to have this consolidation of sleep so we can get all these sleep back to back. As the night progresses, you see this brown red bar on the top. These are called REM sleep or rapid eye movement sleep. And rapid eye movement sleep is about 15 to 25% of your sleep in general. So if you sleep for 10 hours, you'll sleep about 15 to 25% of that 10 hours. One fourth of sleep goes in REM sleep. But as you see, the REM sleep becomes more prominent as the night progresses. Means second half of the night you have more REM sleep, but the first half of the night you have the deep sleep, which is the N3 sleep. And both in N3 sleep and REM sleep, we do our more progressive, losing of tone of the muscles, more deeper rest, more restoration happens in these time. And the deep sleep, N2 sleep, is called the stable sleep, which is about 50-55% of your sleep time in general. And N1 sleep is a transition from wakefulness to sleep, actually. And that's a transition sleep is about 5 to 8% of times. So more stable sleep happens, which is N2 sleep. N3 sleep happens in first half of the night, and or REM sleep happens in second half of the night. So whatever is not REM is called non-REM, and non-REM has been divided into 1, 2, and 3. I'm making this slide. I'm talking about this slide because it's important to understand what is normal. And in medicine, that's how we progress. We need to know what normal is, what's anatomy, what's the physiology, what's the biochemistry, how the normal body is designed to do. And then we have some disease process coming in between, some pathology. Let's say if it is because of a infection happening, or if it's a genetic problem happening, if there is a disease process happening, then how does it modify it? So what's normal? How do we become abnormal? And then what intervention we can do, whether it is surgery or whether it is medication or whether it's lifestyle modifications like we propose. And we do these to see as to how we can go back from abnormal to normal, right? So that's why this normal slide, normal structure of sleep is very, very important. So I'll come back to this slide again and again in my future references. And again, another slide to say the same thing from stage 1. You are awake, you go to stage 1, which is transition sleep, you slightly wake up and you have some hypnic jerks, and then you go back to stage 2 sleep, then you go back to stage 1 sleep. So you go through these till you get a stable sleep. Then you go to stage 3 sleep, and then you go to REM sleep, and this cycle goes on through the night. And multiple cycles happen to get you this building block. So if you are I'm sitting in a room right now, and this room has got the door, they've got a wall, got a ceiling, got a floor. All these are required to make this a room. Otherwise, it won't be of any use. So similarly, we talk about consistency and consolidation of sleep, and I want to come to that slide, and I come to that point again in my future slides. So how much sleep is important? So sleep is a important feature, as we talked about. National Sleep Foundation talks about different age groups. So whether it's a newborn or an infant or a toddler, preschool, school age, teen, young adult, as you can see from this slide, the amount of sleep needed averages out from 14 to 17 hours in a newborn. Of course, they sleep in bouts of 3-4 hours each. They don't sleep through the night, but they sleep throughout the day. And they have more REM sleep, rapid eye movement sleep. Their eyes move all around. But the rapid eye movement sleep is a misnomer of a sleep. It actually, the body is paralyzed. The brain is very active. We still don't know at this time as to what exact purpose does REM sleep serve, but it is apparently one of the most important sleep. So the quantity of sleep for an average newborn is about 14 to 17 hours, which is about 3 months. From 4 to 11 months, the kids should sleep about 12 to 15 hours. And as the year progresses and coming in a second year, preschool time, kids start sleeping less, 11 to 14 hours to 10 to 13 hours. So once you go to school, as you can see, the young kids are going to school at 7 o'clock in the morning. You wake them up, and their school starts at 8 o'clock. And 8:01, they are tardy, but they are up on the phone still about, 2 o'clock in the morning, they're playing on the phone. 9, 10 years old kids nowadays. How would you give them 11 to 14 hours sleep? So that's a challenge we have. So quantity of sleep for a toddler is about 11 to 14 hours. I'm sorry, the toddler is 11 to 14 hours. And the 3 to 5 years old kids has 10 to 13 hours of time of sleep. But this is where the important thing comes up is 9 to 11 hours. So in some places in Florida, we have asked the sleep community have requested schools to be started a little later, maybe 10 o'clock, and so that the kids can get their 9 to 11 hours of sleep, which is required. As we progress to this, average adult needs about 7 to 9 hours of sleep. As we progress from the toddler age to 90-year-old to elderly age, the amount of REM sleep decreases for the first few years, but then it becomes kind of stable. If you see the REM sleep, amount of REM sleep kind of stabilizes for about 15 to 25% of your total sleep. The waking time increases. The total time of sleep actually decreases with age, but we still need the same amount of REM and same amount of deep sleep. Maybe the waking up time decreases as we talked about here. The amount of sleep is persistently stable throughout your adult lifehood. So just because you become old or just because you are working too hard, sleep cannot be compromised, and the quantity of sleep is a very, very crucial factor. So CDC came out with a guideline in 2013 about the amount of sleep needed for Americans, average Americans. And they have published that. You can go and Google, it seems like 2013 amount of sleep needed. And they found out in that study about 20 common diseases people go to doctors for, and that includes diabetes and hypertension and COPD and asthma and heart disease and hypercholesterolemia and breast cancer and yada yada yada. All those 20 causes they have put together. They found that 18 of them are more commonly found in people who sleep less than 7 hours versus people who sleep more than 7. So 7 was a cutoff in that study. So we do say that people should sleep at least 7 hours, if not 8 hours in the night, each night. And that's the quantity of sleep we have to figure out. You mold your life around the sleep rather than molding your sleep around your life. So if you have to go for a party or something, you come back at 11, 10:30, 11, whatever time you go to sleep, and then you make sure that you sleep your next 7, 8 hours before you go to the next day of work. So that's about the sleep quantity and important slide I wanted to talk about. What are the diseases we talk about in general, like 85 different problems? So categorized into we have various means of classifying diseases. In sleep medicine, there are a couple of ways we follow the guidelines from the DSM, the Psychiatry Association DSM-5 classifies in a certain way, and then American Board of Sleep Medicine, the ICSD classification is different as well. So in general, here I have taken one of the classifications slightly easy to understand. We talk about insomnia, we talk about sleep-related breathing disorders like central sleep apnea, obstructive sleep apnea, hypoventilation, etc. In insomnia, there are many other subtypes, people who have perception problems versus people who have psychosociological insomnia. They think that they have not slept well, or sleep because of mental problems or paradoxical insomnia, and all those medical terminologies, which I didn't think the audience is different here. So I'll skip that. Rather than boring you, I would continue with just the main categories. So there are 85 different sleep problems I talked about. Excessive daytime sleepiness can also be because of narcolepsy or idiopathic hypersomnia or substance abuse or taking medications which can make you sleepy in the daytime. Circadian rhythm problem for youth and the elderly is really big issue. We're going to talk a little bit more about circadian rhythm problem today. And that includes delayed sleep phase or advanced sleep phase or irregular sleep phase and stuff like that. What phase simply means is that when we are designed to sleep with the sun and designed to wake up with the sun. Just like our ancestors used to tell us about the Shubh Muhurtam or Brahma Muhurtam, we were designed to wake up before 6 o'clock in the morning. And the Western science has kind of not catch up with that idea that we need our 8 hours of sleep and we need to wake up before sunrise. And so ideal time to sleep would be 10 o'clock to 6 o'clock in the morning. So that is called a right phase. But if you sleep early, which is what elderly folks do, among our audience, with those people who are more than 70, 70 years old, they will tend to feel sleepy by 8 o'clock in the evening. They tend to go to bed by 9, and then they wake up at 2 o'clock in the morning, and then they don't know what to do. And then they complain about insomnia. But then they don't realize that insomnia is because of the phase problem they have. Similarly, we have some parasomnias, which are not necessarily diseases, but they are actually something goes kaput, let's say in deep sleep or transition phases. You get into those talking modes or walking mode or sleep terror or nightmares. So these are called some parasomnias, which usually are benign. We don't have to intervene for that, but good to know that they are normal and not something abnormal. And then there are sleep-related movement disorders like, frankly, seizures, for example. More seizures happen when sleep apnea or other sleep problems, or you have restless leg syndrome or periodic leg movement. And there's a definition and treatment and pathology and well-defined processes for these to be able to identify them. So this just justifies as to what the sleep disorders could be, giving you a gateway to the sleep disorders. And we want to make sure that we understand this. So many things we consider normal. All these years we consider normal. Oh yeah, I snore only when I'm tired, or I snore only when I'm in the bath, or I don't have a sleep problem. I can sleep just like that. I can sleep anywhere I want, the way I want to. I go to bed and sleep like that. All these are big problems because now we know that they are not normal anymore. But nobody told you that it's abnormal, right? So this is just gives you an idea as to sleep medicine goes much more deeper than just able to sleep or sleep enough. What can sleep deficiency do? I mean, a lot of times we feel at a young age, especially when we feel that we are omnipotent, omnipresent, we can do anything, nothing will happen to us. We feel that even sleep is kind of a misnomer. We don't need sleep. It's overrated. Actually, it's not true. Sleep deficiency can interfere with your work or school or driving, social life, trouble learning, focusing, reacting. It can actually aspect of all your emotional and social life, actually. It's also, hard to perform. So emotions, reactions, you also not being able to have a good relationship because you're always frustrated, cranky, or worried. And these we classically see in people with insomnia or people who don't sleep well in the night. Think about taking a red-eye flight from San Francisco to New York City, and you get up in the morning, and tomorrow you have to do a meeting. You just are not present. You are not able to bring up your thoughts together. You're not able to talk in a straight sentence sometimes, or you're not able to get your, maybe you are irritable, maybe you. Those things we all have experienced. So sleep, and if you do this night after night after night because of a bad habits or bad perpetuating a problem, or you have a actual sleep problem like sleep apnea, for example, then these lead to daytime fatigue and overall performance in the long run. So the signs and symptoms of sleep deficiency may differ between children and adults. Children mostly presents with overactivity, and ADHD is one of the commonest presentations, but and attention deficits, and they also misbehave and poorly perform. But most adults present with crankiness or psychiatric issues, or maybe because of sleepiness linked called excessive daytime sleepiness, dropping off sleep in inadequate situations. So one of these slides is here from basically taken up from sleep apnea, those who have sleep apnea, and I'll give you some slides as to what it means. It simply is basically apnea means it's a Latin word with a, no, and pnea means breathing. So no breathing. So sleep apnea, no breathing in sleep. And it can be totally closure, no breathing, absolutely no breathing, versus partial closure, so partial breathing. It's called hypopnea. So sleep apnea and hypopnea both cause that. Each time the airway closes down on us, we have to wake up for a few seconds to open the airway back again and then breathe. And then the brain goes back to sleep and the airway closes again. So that leads to multiple awakenings in the night, and that awakenings affect the quality of sleep. And because they affect the quality of sleep, you are not sleeping enough or sleep quality is there, then this leads to daytime problems, as you can see, increase in accidental death, for example, or increase infections or cognitive dysfunction or brain. A lot of those brain activities, memory problems or moodiness or depression or accident prone or getting accidents, things we don't realize, they also are linked to, very strongly linked rather, to sleep deficiency of sleep in the night. So thinking that we don't want to have sleep, or it has little, no sleep has no negative effects, is not going to help. So avoiding a problem does not solve the problem. So this leads to hallucinations. Your immune response is weakened. A lot of time people get 3, 4 infections in a year, or they get even weight gain or weight loss, cold, flu, type 2 diabetes, heart disease, high blood pressure, and many other things can lead to sleep apnea, or sleep problems can lead to many of the diseases in the body. So what is good sleep? So a lot of times we have certain, as we develop some habits and we think that this is normal, but good sleep is here listed in some of the things I made up from many different comments, is establishing a regular schedule with consistent bed and wake time. So I was talking about the 8 hours of sleep required. I was talking about Brahma Muhurtam. I was talking about how you need to wake up before 6 o'clock in the morning. Of course, there are situations which is not where people are working, for example, in a shift work, going to nurses, for example, going to work at 7 o'clock in the evening, coming back at 7 o'clock in the morning. Obviously, they can't wake up at 6 o'clock in the morning. Or somebody who is coming home at 10 o'clock in the night and then had to have some dinner or do some other chores and go to bed at 2 o'clock in the morning. So either way, we want to make sure that you need to maintain that consistency of sleep-wake cycle. Just like the sun comes up at 6 o'clock in the morning, no matter at what time no matter how powerful it is, it doesn't come up at 2 o'clock someday, at 10 o'clock someday, or whenever it feels like it. 6 means 6, so it has 6 come at 6 o'clock in the morning, and our body is linked to that. So that's circadian rhythm basis of that. So we need to have a consistent bed and wake time, because every other hormone in your body, every other process in your body is linked to that sleep cycle. So sleep is the most important thing in the body. Apart from having a breakfast at 8 o'clock in the morning and your lunch at 12 o'clock in the afternoon, and maybe at 3 o'clock you have your snack, and 6, 7 o'clock dinner. I mean, those are also governed by these sleep timings, which also generate or secrete your hormones for thyroid or growth hormone or your sexual hormones or your cortisol levels, and everything has got a cycle, and they all are very much dependent on sleep cycle. So a consistent bed and wake time is very, very important. Then maintaining a relaxing bedtime routine. So not that you want to go for exercise for 2 hours and come back and sleep. Can't do that because your adrenaline response will be very high. So you want to do your exercise 2, 3 hours before bedtime, your diet or dinner 2, 3 hours before bedtime. So things which we want to make you relax, not watching a very high intense thriller movie also makes your sleep disturbed as well. So some kind of relaxing bedtime routine will be helping. And sleep promoting environment. So if you go out at night at 2 o'clock in the night, you'll see that that's how nature designed it to be. We are animals. By 10,000 years ago, we were animals, right? Living in the jungles. Now we have TVs and cell phones and tablets and this one and that and all other activities we do. But if you go out at 2 o'clock in the night, you see that the environment is very quiet. There's not a single sound. It's dark and it's like a little bit cool as well. It's exactly how you want to keep your room as well. Comfortable, quiet, dark, and preferably cool. No fluids 2 hours prior to bedtime. You don't want to keep on waking up at night to go to the bathroom all the time. And don't eat too much close to bedtime. 2 hours is what they say. So 2 hours for eating, 2 hours for drinking. No caffeine 10 hours prior to bedtime. Even 8 hours prior to bedtime, we have studies which show that it leads to fragmentation of sleep. Fragmentation means you're waking up even for 3 seconds, which you don't know. It's called fragmentation by definition. So fragmentation can happen because of nicotine or alcohol 4 hours prior to bedtime, or caffeine up to 10 hours prior to bedtime. Exercise, not 3 hours. I mentioned that already. Limit time in bed. So I've seen people just because they have a bed and maybe for whatever reason, maybe they have, let's say, a studio and they have a bed and a table and chair, and they will do everything on the bed or lie on the bed for just because my back is hurting. I want to lie on the bed for 4 more hours extra. But if you lie on a bed for 12 hours, you don't necessarily sleep for all 12 hours. You go in and out of sleep, and that is also affecting your quality of sleep. It's not back to back of cycle, which we talked about before. So limit time in bed to just about 8 hours. You make a time, you be in discipline, say I'm going to be going to bed only at 10, and I'll get up out of bed at 6 o'clock no matter what. I will not drag myself for 2 more hours just because I can. So you want to limit time in bed and avoid watching the clock. That leads to the super anxiety in the body. And that's called classical psychophysiological sleep, right? So if you are, I'm going to sleep, I have to take exam tomorrow. The more you try to sleep, the more you push yourself to sleep, it's not going to happen. So you need to avoid looking at the clock. So they say put the clock face down and not look at the clock, think of tomorrow, not think about what happened today, not get yourself worked up. So avoid watching the clock, and then this is something, limit naps to less than 1 hour if necessary. And studies have shown less than 30 minutes, and some studies have even shown that no nap in the daytime. So when you actually do sleep in the daytime, that takes away the quality of sleep in the night. Even 1 minute of sleep is going to bring down the sleep hunger, we call that. So what do we do and what we don't? So maintain a good sleep cycle, exercise up to 30 minutes on most days of the week, but not within the 2-3 hours of sleep time. Increase exposure to bright light during the day. As we expose, as I said, sun exposes, and I'll show you one slide next one. The exposure to the sun wakes up the entire system, the master switch, and then the cascade effect. And keeping the sun exposure, so bright light is the biggest entrainment, we call it entrainment, and that is the one which keeps you awake. So you should expose yourself to bright light all day long. Have a relaxing routine prior to going to bed. Establish a good sleeping environment. Use the bedroom only for sleep or sex, and limit naps to not more than 1 hour or no naps. And you want to avoid stimulants, avoid alcohol, avoid any other medication that disrupt the sleep. Don't take melatonin, don't take Benadryl and stuff which people commonly take to go to sleep, because that's going to make your actual sleep reasons being worse. And avoid late afternoon naps. You don't want to sleep after 2 p.m. for sure. So I've been talking about circadian rhythm throughout. Circadian means a cycle. The nature cycle is 24 hours. Sun wakes up at 6 o'clock and gives up the thing to moon, and moon takes over at 6 o'clock in the evening, and then they transmit. And then they have the yin and yang, and that actually runs the entire universe. Every living being, whether it's a grass or the grasshopper or the mosquito or plant or any leaves or every other thing, and including all 8 billion humans in the world, we all govern by the sunlight, and we are governed through the sun, through the eyes, into the central part of the brain, and that is the central clock called in the suprachiasmatic nuclei. That is the master switch in the body, and it governs everything which happens, endogenous clock. So the entrainment is happening through the sun, which is through the eyes. Our body internal cycle is about 25 hours, but we also function for 24 hours because the entrainment is given by the sun. So the environmental time signals called entrainment, endogenous clock, the autonomous or adaptable or genetic, whatever happening in the body. And that is through the suprachiasmatic nuclei. They secrete a whole lot of hormones. And then we need to, these all hormones, you can think about how important the thyroid hormone is, or a growth hormone is, or prolactin is, or other sexual hormones are, or your GI hormones are, or your heart hormones are. They all lead to these they all are linked to these next to each other, the suprachiasmatic nuclei. So sleeping with the sun is one of the best things you can do for yourself. Getting up in the morning and going out and seeing the sun is also one of the best things you can do for yourself. So ask yourself this question: what time do you naturally prefer to get up? So if you want to have that, the personalization for sleep, which I was asked to talk about, you need to answer those questions. So when I'm talking to patients in the room where I'm sitting right now, so we do talk about these. These are some of the questions I base my recommendations to patients. What time do you prefer to get up? What's happening? How do you work? What are your own hours? How many hours you would like to sleep? What do you get? What would you like to get? And how can we make, are you working on a shift work? And are you able to keep these hours? How long you've been not been able to, break these patterns? So, and how can we help you break those patterns? How to get you exposed to sunlight? How to give you melatonin? And what time should I give you melatonin? Stuff like that is important for me to answer. And you should probably be taking that cue as well. Ask these questions, answer these questions, and maybe we should be able to solve as to how can you get your quality and quantity of sleep is important to get your daytime functioning better and living healthy. So tips to maintain some of the important things: get sunlight. Again and again, I mentioned that you get up at 6 o'clock in the morning and get the sunlight. Maybe you want to wake up at 7 o'clock and get your sunlight, or even 8. So I am not a 5 o'clock person, so I do get up at 7:30 in the morning. I do get to bed by 11:30 and 7:30 in the morning. First thing I do is I do go to my backyard and wake up. And some cultures, they talk about Tai Chi, some cultures talk about yoga, sun salutations, or Surya Namaskar, whatever we call that. I think it's important that the Eastern cultures were much more advanced in the Western world, but this does help with even a depression as well, and the whole body getting into active mode. Exercising a little bit helps every day, 30 minutes, then keeping the nap short or no naps. Again, avoiding caffeine, especially second half of the day, and avoiding using electronics in the bed. When you go to bed, it is bedtime, that's it, lights are off, screens are off. If you want to play with the screens, and some studies have shown that even 2 hours prior to bed, screens are not good, but you definitely don't want to take it to the bed for sure. And building a consistent sleep schedule for sure, and being in discipline, going to bed at 10, waking up at 6, going to bed at 10, waking up at 6, keeping your phone 5 feet away, and getting sunlight in the morning, something of that sort. So there are now insomnia, which I mentioned how insomnia is the number one complaint in the nation. Almost about 40% people have complained about insomnia throughout. I have about maybe 10% of our patients come and talk about insomnia or they can't sleep. But when we ask the history, we realize that they are categorized into many different headings. So insomnia is a common terminology, but when we start asking questions, we realize half the time they are actually sleeping enough. It's not necessarily just the insomnia part, not able to sleep. Oh, I can initiate sleep, but I get up at 1 o'clock in the morning and then I go to the bathroom and I cannot sleep after that. No, then you ask more history, then you realize actually they took a 4 hour nap in the afternoon. So you took a 4 hour nap in the afternoon, you went to bed at 9 o'clock, you woke up at 1 o'clock, you got your 4 hours again. That's what you need, 8 hours. So obviously you can't sleep anything more than that. So each of these categories, I don't want to go with much deeper, but basically there are many, many different reasons for insomnia. And it's a difficult history taking, but as long as we get the proper history, we should be able to categorize into each of these subheadings, and then we can address those insomnia issues. And we were surprised, just about 5% people actually need medications. Most of them actually need behavioral modifications or some other sleep problems has to be addressed. So what happens in chronic insomnia? People who have been having the daytime problems because of not being able to sleep in the night, actual insomnia, not necessarily all those categories I showed you about. So there are some predisposing factors, biological traits, or maybe there are some genetic factors or psychological traits, or maybe social factors, spouse not sleeping in time, for example, or you're partying all the time, you have friends like that, or you live in a dorm, you're in a school. So there are some social factors which gets into your way. and then you precipitate that with certain medical or psychiatric illness, and then you perpetuate that problem. And that perpetuation is the one where we intervene in the medical science to have that don't sleep, lie on the bed for 10 hours, lie on the bed only for 7 hours. Sometimes I call that sleep restriction therapy. So you don't have to be, if you lie on the bed for 20 hours, just because I worked for the last 15 years too much, I should now retire and I should sleep 20 hours a day. It's not going to work because I will need only just about 8 hours of sleep, right? So if I need only 8 hours of sleep, then I would be sleeping and waking up, sleeping and waking up. In that waking up periods, I may go down to the fridge, get some cake, come eat something, and come back. Then I'll sleep for 2 hours. Then I'll open my phone, I'll play with the TikTok for a few hours. Then I'll play this, and so if you count all those hours of sleep, that still will be just about 8 hours. So to have that good sleep, you want to sleep just about 8 hours, sleeping from 10 o'clock in the night to about 6 o'clock in the morning, ideology, right? So perpetuating factors has to be broken. Changing habits is hard. So we need to look into as to how we can, do the habit change. And sometimes it becomes harder for small practices like me, where I don't have a team of 20 people to take care of issues. So I send them to Stanford, where they have the cognitive behavioral therapy department, the whole behavioral sleep medicine department, where they sit down and give you negative and positive feedbacks as to how you did with the questionnaires and stuff like that. That helps a lot in breaking the model of chronic insomnia, which happens in less than 5% of people actually. Sleep diary helps as well. So this is from the National Sleep Foundation, which is older method when cell phones were not or apps were not as common. So these we have been practicing for the last 20 years. We ask the patient to take a record as to what time you went to bed, what time you got up, how many time you take to sleep, and so now we have those recordings done by watches automatically, right? So these are the gyrometers on your watches, Apple Watch or any of the Fitbits and stuff. They can give you this kind of a sleep diary concept. But what it doesn't do is why was I disturbed? Those questionnaires, what was going through my mind, why I was disturbed, why I got up in the night, I went to the bathroom 4 times in the night. So those questions sometimes help us in understanding. So I have given 2 weeks of sleep diary to people sometimes to maintain that. So when they come back, then I can get a better sense of as to what's going on with them. So sleep diary maintaining sometimes gives you also a feedback, a positive or negative feedback as to what you did. But you want to be honest to it. You don't want to be obsessed. You don't want to think too much. You don't want to be anxious about it. So we don't want to be over obsessed about maintaining a sleep diary, but in a positive way. So the other, sleep apnea can itself, like closure of airway I was talking about, how sleep apnea does, and that closure of airway can happen because I think my theory is that we were monkeys and gorillas before with the big jaws and hanging feet, and the jaw was hanging, and now we are more supine, more erect, and then the jaw has regressed. But I think the back of the neck has not oral cavity rather. So back of the oral cavity is not modified as much. It's still evolving, I'm assuming. So that's why about half of us have these airway closure. The air does not close in, especially in the night. And that leads to many different daytime problems and much more than what I have mentioned here. Hypertension or diabetes or depression or insomnia or early death, heart attacks, strokes. Almost about 82% of strokes have links in sleep apnea. Almost about 60% of heart problems have links in sleep apnea. So-called memory loss or depression, they also have huge imprints on sleep apnea. So if somebody is snoring, he's not just right to say, hey, he's snoring because he is just too tired, and that's why he snores only on some days. I think it's always a good idea to go check it out, and we need to figure it out as to how, if you have diabetes, if your diabetes control is poor, means if your hemoglobin A1C is more than 7.5 and you are on medications, I think it's a good idea to go ask a doctor to check for sleep apnea or look for symptoms. If you have heart attack, if you have arrhythmias, especially atrial fibrillation, you want to ask a doctor to go check for sleep apnea for sure. So this is how sleep apnea, I mean, when we do sleep studies, right now I'm in a sleep lab. I have a couple of bedrooms there. And this is what we do. We put all those EEGs on the head around, a couple of wires around the eyes to see the EOGs, a couple of chin EMGs to see as to how the recording is. And the breathing, we put belts in the chest on them. You can look it up. So basically, we record all the breathing in and out and the EKG as well. So we do multiple channels recording all night long to figure out if the person is having any kind of problems in the night. And that is what is right now it shows is this window is normal sleep, basically. And this is here is what happens when you have not breathing. As you can see, you're breathing and then you suddenly stop breathing totally, no breathing happening at all. But you're making an effort to breathe, but airway is closed. And this is classical obstructive sleep apnea, which is what happens right here. So obstructive sleep apnea means close. So the patient is ready to breathe. The brain is giving a signal to the lung, dude, breathe, breathe. But then no air is passing through because the airway is closed on you. And at that time, the patient has to wake up. He woke up right here, and then he started breathing one more time. So this waking up is what we call as a problem. It leads to daytime fatigue and daytime sleepiness. You doze off watching TV, doze off sitting in the park. Those are not good. And here is one slide which I talked about earlier, that the more accidents on the highway are happen because of sleep problems, not necessarily because of DUI or consuming alcohol or drugs or whatever. So sleep deprivation is no way to drive. There are so many accidents. This is from National Highway Safety Association. So we need to be sleeping enough. We need to be sleeping, taking care of your sleep problems if you have any before we get on the highway. And with this, I'll conclude my talk, and thank you so much for your attention.
Thank you so much, Dr. Sanjay, for your really great presentation. There was so much great information, and I like how you ended off with a really important tip about public safety. It was really interesting to hear more about your research as well. It didn't even occur to me. I've been in lots of different labs, but it makes sense that you have bedrooms in your sleep lab. That makes that makes a lot of sense. I never thought about it like that. But yeah, how else can you study sleep without facilitating that in that kind of space? That was really interesting to hear about. So I'd like to transition over to our Q&A section. We have a bunch of questions that our participants had put in, so I can kind of summarize them and kind of look at some of the key points, and then maybe we can hear your insight for each of them. So our first question is asking a little bit more about tracking your sleep. So they've asked, would you suggest to keep a monitor for sleep time or keep a sleep diary to make sure that we have a pattern? So what are your thoughts on sleep trackers or any kind of monitoring system for sleep?
All these new devices, many new devices have come out which track your sleep. So I think they are okay to some extent. I won't make medical decisions based on that, but it gives you good feeling. But I don't want you also to not be too anxious and too hung up on that. I have had patients who come in and say, "Hey, look at my sleep recording from the Apple Watch is showing me that I'm sleeping only 3 hours and I don't know what I'm doing, and I'm in the bed till 10 o'clock, and I think it gives you certain good feel about it. It certain gives you a good, let's say, guesstimate of the problem. But I won't depend making medical decisions on that. I would still talk to a qualified professional before making any judgment on those.
Got it. Yeah, especially with the rise of a lot of these wearable tech devices, people
Yes,
are getting more
yes,
insights into various aspects of their health. But your opinion is more of it's like a general tracking. It's not necessarily something you can use to make medical decisions or
medical
anything.
decisions for sure. Yes.
Okay, for sure, for sure. We had a couple of questions about kind of napping. So people asked about power naps and if they really help or if they might mess up your sleep later at night.
So that depends on person to person. So sometimes I do give prescriptions of power nap to especially those people who have let's say only sleeping 6 hours because of two different jobs, or coming home at 4 o'clock in the morning but have to drop kids at 9 o'clock in the afternoon, 9 o'clock in the morning they take the kids to work. I mean, social life takes over sometimes. You can't just get 8 hours of sleep at the same time. So for them, I do advise them to have some certain power naps. But then those people who are perpetuating a long-term insomnia problem or something because they have been sleeping 10 times a day, for them, I'll give them again a half an hour power nap. But in general, a power nap is not advised. So average normal people who are able to sleep from 10 o'clock to 6 o'clock in the morning, power nap is not needed. It actually affects your quality of sleep at night for sure.
I see. Got it.
So
And then also,
every situation is
oh,
different.
got it. So
That's
each person's
personalization.
situation is different, and
Yeah.
yeah, sometimes it might be beneficial. Um, and on that point, actually, so I'd also learned about the rhythm and how a cycle takes around 90 minutes. So would you also suggest perhaps like timing your sleep to fit one of those 90 to 120 minute cycles would be beneficial? So within, you know, multiples of 3 hours, or is that a good
Uh,
strategy?
I wish I wish it was that simple. It's not. In medicine, as two and two, I always tell my patients two and two in a software professional world in Bay Area, we have two types of Indians, right? One, we have software professionals, and one, we have doctors, right? So basically, the software professional world, two and two is always four. In medical world, two and two is never four. We cannot say that two and two is four 100% of times. We can say two and two and four is maybe 10% times. It's maybe 3.92 in 20% times. So it's all about permutations and combinations. Means it's 90 to 110 minutes in ideal world. But then I have had patients who have a sleep study and they have the first REM cycle comes after 300 minutes. So it's not necessarily 100% true. It doesn't happen with everybody. So you cannot say that, okay, after 90 minutes of cycle or 120 minutes, I'm done. I can take one break now. I can do, because remember, first half of the sleep, you also have the deep sleep come in the first half. And then the second half, the REM sleep comes in more often. So you get more quantity of REM second half of the night. So if you do only 2 hours of sleep, then you pretty much get deep sleeps and maybe a speck of REM. And you will always do that. You will never get the full REM cycle of 25%, which is the which is needed to be for the rejuvenation of the brain.
I see.
It has to recuperate. So I think that's why we suggest a consolidation sleep as much as you can. Of course, everybody's situation is different. In that condition, we advise them to, in certain aspects of that cycle, I intervene in between.
Got it. Got it. For sure. We have another question here that's talking more so about not necessarily the duration of sleep, but when. So this person has asked, is sleeping from 12 to 8 the same as sleeping from 10 to 6? Is sleeping earlier, quote unquote, worth more than waking up later? Is their question.
So, if you ask me, yes, 12 to 8 sleeping is fairly as good as sleeping 10 to 6, because I'm not a spiritual person, for example, at this moment. But yes, in spirituality wise, in Indian world, they are talked about how sleeping early, waking up before sunrise is considered to be good. So, two different worlds, but yes, sleeping 8 hours consistently, 12 to 8 is perfectly fine. But they say the development of the brain is better if you sleep with the sun and wake up before sun. That's a spiritual world. So in
Got it.
my mind, I think asking me medically, yes, 12 to 8 is equally good.
Got it. So that duration, no matter where it kind of falls in the window,
Yeah,
is more important rather than
yeah.
the hours on the clock.
Following. So that is called delayed sleep phase, though. So remember I was talking about how circadian rhythm, the ideal time to sleep is 10 to 6. If you sleep early, which elderly people do, they sleep about 8 o'clock in the evening, they tend to go to sleep. And then they wake up at 2 o'clock in the morning and they don't know what to do after that. And they see their grandson is sleeping and everybody else is sleeping in the house and they try to sleep and they can't sleep anymore. So that is called advanced sleep phase. But if you sleep late, like this gentleman is talking about sleeping late at 12 o'clock, and that happens with young folks. So when you are an adolescent, you tend to sleep actually by physiologically, they have delayed sleep phase. They tend to go to bed at 12, 1. And we have perpetuated the problem, making it worse by being on the cell phone at that time. And everybody is you and I understand the fear of missing out and all those things which you guys use. What do you call it? FOMO? FOMO and all. Everybody is on what are the social sites, man? Yeah, Instagram and all that. I'm not a member of any of these, but yeah, everybody is like sending likes and stuff like that, and you don't want to be left out, and you're playing that phone till 4 o'clock in the morning, and then you wake up at 4 o'clock in the afternoon. So, but then think about it. When you wake up, and I also mentioned how you go out at 2 o'clock in the night and you see that it's cool outside, it's quiet outside, it's dark outside, and that is an environment which is conducive to sleep. But after 7 o'clock in the morning when the sun rises and everybody else is active in the world, and in India, there's horns blaring all around, and in the home, you have other people walking around, somebody doing something else. And I think that leads to the fragmentation of sleep, whether you like it or not, and the light peeping it through the window. You have not made the curtains totally dark. So
Mhm.
the home is not prepared in general for the nighttime sleep. Like sometimes nurses come to me, my patients, I tell them, you go home at 7 o'clock in the morning. You don't do stuff like cooking around and cleaning and all that. You get to bed, you close the house, you close your room, make dark curtains in the room, so make the room temperature cool, and then you wake up at 3 o'clock in the afternoon. So that doesn't happen in general. So that's why, in general, it's not advisable to sleep when the sun is around, because that does affect the quality of sleep in the night.
I see. I see. Got it. And just a comment to all of our audience members and participants. We just ask you to keep the questions very general, not to share too much personal information because we want it to, be beneficial to all of us. So especially to our youth participants, keep the questions coming, but just keep them a little bit more general. But yes, we'll be going through the other ones as well. But I think one piece of advice that you'd given in your presentation, Dr. Sanjay, was that you should use your bed just for sleeping. And I think that was a good idea because, as I remember, especially during my own experiences in high school, I would find myself doing my homework sitting on my bed, and the bed no longer just became a place just to sleep. I think by creating that boundary and keeping that more rigid, as in like, no, bed is just for sleeping, is a really good piece of advice. And that kind of leads us into our next question, which is asking, will getting less sleep have a negative impact on my studies?
Yes and no. Remember that I talked about how deep sleep is important, how REM sleep is important for the brain to regenerate, right? So the memories in the older or newer brain, the memory cells work well when they are not loaded. So if you there are certain studies I think have done a psychological thing that you read something and then you go to sleep and then you actually capture it more and remember it more for a longer time. Then they're thinking that how do I say it? Sleeping after the reading something, it actually deepens the memory, you know. So yes, it will affect your quality of sleep for sure, quality of your memory as well, or your studies as well. Performance will be affected for sure.
Got it.
Just to summarize.
Definitely. Our next two questions are kind of similar. So these are like activities that you can do right before perhaps going to bed. So some people are asking, can we do stretching exercises before sleep, or does meditation and yoga improve the quality of sleep? Or are there any specific techniques that you can do right before sleeping?
Mild stretching, maybe. Extreme stretching, no. And meditation and yoga can help, but depending on as to I'm not expert in meditation, but I've heard that meditation a can become intense as well. So light meditation does help. I don't want you to do extreme stretching exercises before sleeping as well, because you don't want to. The idea is that you don't want to have the adrenaline system kicked in, and too much of thrill and excitement kicked in as well. So as long as we're not doing that, for whatever means it is, we should be good.
Sorry, an alarm is just going off in the background. It just ended, which is perfect. Okay, so kind of
Totally
going
fine.
back to our last bit of questions. Um, do you have any other? So one question that we got was like people sometimes have their mind occupied with a lot of thoughts, and perhaps that's not letting them, drift away into sleep. Is there anything that you have insight for about like clearing your mind or keeping it clear before drifting off into sleep?
Very hard. That's a tough question. So that is something I have always have a hard time with. I mean, thought free of getting your mind free of thoughts. So sometimes, I mean, they talk to you about counting your sheep or doing something or not thinking about it. The more you try not to think about it, it goes into psychosocial insomnia. I think we just have to learn how to do that, I guess. Not thinking about tomorrow. You have to say, hey, what is gonna boss gonna think and this gonna happen, what's gonna happen. So as long as you say, you know what, I'm gonna think about it tomorrow. Let's not stop thinking. Let's stop thinking about it. I think sometimes just putting a stop is the only way I can say. I don't know. There's no tips for that actually.
Right, right.
Especially
Yeah, that is
counting
tough. That
counting
is
counting sheep is what they say in literature, right? So you have to count your sheep to get things done.
yes, definitely, definitely. Sometimes you just have
Getting
to,
bored.
start clearing your mind
Music,
in other ways or finding strategies.
yeah.
So,
Light music helps sometimes. There are soothing music Apple has come out with. There are so many of these apps with it, water falling or some birds chirping and stuff like that. But you still tend to think. You still tend to think about the problems I'm saying. Yeah, there are many
right,
of those apps help you with getting you to sleep. But people have come
right.
and told me nothing that doesn't do anything for them.
What do you
Yes.
think about you mentioned music, or what about those apps that have like white noise, brown noise, or like they kind of have like that humming in the background? Are those beneficial, or is that kind of just depends on person to person?
Well, it's person to person again.
Right.
So you have
Okay.
to try it out and see what works for you. I
Yes.
mean, with the white noise in the back of the fan running, for example, I mean, if you still have to think about what's going to happen tomorrow, you're still going to think about tomorrow, fan running or not. But yes, fan can help you um, suppress some of the noise in the background, which is taking your attention away, for example.
So our first question that we still have was, is snoring common in children?
So snoring is common in children as well. The proportion, of course, increases as we get older. So there are kids who are between 0 to 10 years of age. The incidence of sleep apnea, sleep apnea is part of snoring. Snoring is not necessarily a disease, but is about 2 to 4%. So different studies have shown that's fairly common. So there are people who are on CPAP machine, kids as well, and there are kids whose treatment of choice, of course, depends on the age group, but mostly between 5 to 10 of the age, we do tonsillectomy for them, tonsils and adenoids.
This is actually
So the last question is, my sport practice is scheduled for late in the evening. What's the best way to manage my sleep schedule? Because I believe in the presentation you kind of stress the importance of not doing physical exercise right before sleeping.
So, I mean, it depends on in the evening, then, maybe you should give at least about 2 hours of window before you come back and get to bed, because then you'll be lying on the bed, not sleeping in time, in
I see.
general. Yeah.
Got it, got it. So good general practice is at least 2 hours of a window between that exercise or that
Yeah.
sports practice
Yep.
from sleeping.
And then come back home and sleep after that.
Got
And
it.
make it a habit to get your 7.5, 7 hours sleep after that, at least, for sure.
Right, definitely. So I'd like to use this time to thank Dr. Sanjay. Thank you so much for your expertise and your presentation. It was really great hearing about your expertise and your impact and hearing about your research and then also all the information that you shared with us. So thank you.